What's causing the aches and pains in your joints? And could they be a sign of something serious that needs urgent attention? Arthritis is far more complex than people realise, and knowing the difference between types of arthritis is incredibly important when it comes to looking after your health. Today, I'm joined by an expert who's equally as passionate as me about truly helping people live healthy lives with confidence. Amanda Mimoni, co-founder and lead physiotherapist at the Physio Rooms. Amanda specialises in treating patients with all kinds of musculoskeletal problems, trying to guide her patients to live active and functional lives. Together, we'll break down what actually differentiates these two forms of arthritis, the impacts they can have on your daily life, and most importantly, what you can do to stay active, reduce pain, and thrive. Amanda, welcome to The Health Perspective.
Thank you so much. It's a pleasure to be here.
Can I start by asking you a very broad question?
Sure.
What is arthritis?
Broad answer, inflammation of the joints.
Now give me a more specific answer.
So arthritis, I would always say I prefer splitting it up. So you have inflammatory arthritis and osteoarthritis. Osteoarthritis is when there's degeneration to the cartilage at the joint. Inflammatory arthritis is when there's inflammation to the joint caused by usually something to do with the patient's immune system.
Okay. And osteoarthritis is the one that I guess we used to call wear and tear.
Yes,
but it's
which
not,
we don't.
We don't. So how do you explain that? Because I think people struggle with the idea of degeneration not being wear and tear. So how do you go about explaining that to a patient?
So unless a patient's come in and said, right, I've got wear and tear of my joints because a doctor has told them that or they've seen it online, I will always say to the patient, it's not wear and tear, because what wear and tear is saying to a patient is that it's something that you have done over time and that it's something you will continue to do. Whereas we know that osteoarthritis is degeneration to the cartilage at the joint, right? So it's thinning, there's a reduction in the patient's joint space because of age-related changes to their joint. It's got nothing to do with what they have done or what they will continue to do. And I think I always try and make that so clear, because what wear and tear, that term does, it just brings fear into the patient. It just brings fear into the person that, my gosh, like if I carry on now with walking, with exercise, I'm just going to make that wear and tear significantly worse.
Okay. So thinking about specifically this osteoarthritis, the degenerative one, what are the kind of risk factors there?
So risk factors for the osteoarthritis is age. So it usually happens to someone over the age of 45, usually women as well. We see it in a high number of women compared to men. Weight, there's a high link between obesity and osteoarthritis.
That would be in the lower joints.
Yes, in the lower joints. And then also injury. So if you've had a previous injury, it can accelerate that degenerative process as well.
Okay. So I guess one thing I wanted to do is to break down some myths today. I guess let's think about one myth, is that arthritis doesn't affect young people.
Yeah. So it depends. So osteoarthritis, we know is age related, right? So we know that it happens as our changes happen to our body as we get older. But firstly, if you've had an injury to that joint, it can happen a bit sooner. Secondly, when you're looking at inflammatory arthritis and you have the genetic predisposing factors, so if your parents have had it or grandmothers have had it, you're more likely to have inflammatory arthritis. So it can be something that you get younger for sure. And is that something that in your clinic that you spot earlier?
Yes. So I think you're right in saying that there are typical, as with most medical conditions, there are typical patterns with osteoarthritis affecting people usually later in life. But with any medical condition, there are always pattern kind of breakers as well.
For sure.
And you have to be alert to it. And certainly in athletes and people who've done an incredible amount of kind of competitive sport, that kind of degenerative arthritis can definitely come on at a younger age. Inflammatory arthritis is definitely associated with younger age. And as you said earlier, it's an autoimmune condition, which is effectively the body attacking itself. So developing antibodies instead of fighting an infection, it develops antibodies against itself, and starts attacking parts of the, well, in the case of inflammatory arthritis, joints or joint capsules as well. Another myth, I guess, that I wanted to make sure we spoke about was that if you have arthritis, you shouldn't exercise or you shouldn't move the joint, which is something I hear a lot from patients, and there's a lot of anxiety around that. How do you work with patients on that, and what's your view?
So for me, when I have a patient that's like, well, I can't do the things that I now want to because I've got arthritis, it's just going to make it worse. What I say to them is always, I talk about the evidence. So when we look at things like the NICE guidelines or the evidence that's always being published now, we know exercise is the way to help it. Right, we know that by strengthening the muscles around the joint, it helps protect it more. It alleviates pain because we know that. And actually, the more that we move and the more we move within our pain allowance, you will have an improvement within your pain. And we're not saying to go from not moving at all to right now you've got a program you're going to do every day, you're going to walk every day. It's a progressive program that you will do that you for sure will see improvements in. And I think explaining why exercise is so important always brings someone on board. I think it's the explanation rather than just saying you need to do it.
Right. I think where people get most worried is the idea that they've got a degenerative arthritis and that they're going to then cause, so let's say you've got a degenerative arthritis of your knee, and that they're then going to cause more rubbing, more friction. And well, I guess the idea is that like there's a lifetime on the joint. Like if I've only got a certain number of times I can use it, and I don't want to waste, by kind of walking or exercising, because I'm going to cause more wear faster than it should be happening.
Right. I think it's debunking that myth to the patient of if you're going to walk more, your knee pain is going to get worse and the osteoarthritis is going to become more severe, because it's just not true. The truth is that the knee, if we talk about again the knee, the structures around the knee need to be strong in order to protect it. So if you don't have good strength at the knee, if you don't have good range of movement, and then you're going for a walk, you're then overloading your knee, right? But if you actually build the structures around the knee to support that joint, if you keep that knee joint strong by strengthening the muscles, if you keep it mobile by walking, by swimming, by finding that exercise that you find comfortable, you're actually going to be better off with less pain and less likely to have worsening osteoarthritis.
That's really helpful, actually. And I don't think I do a good job of explaining that to my patients. And it reminds me of an analogy that I use with my patients for mental health, which is putting a plaster cast on an arm. So if you break your arm and you put a cast on, the cast doesn't fix the bone. The cast is just there to effectively provide scaffolding so that the bone heals over time. So I think and I've used that analogy with antidepressants as well, how they're not a cure for depression, but they're there to effectively provide a scaffolding for your mental health, whilst you then do everything else that you need to do to kind of build the real strength. So it sounds like what you're saying is building the scaffolding or building the strength in the muscles is what's really important to provide the protection to the joint, and the exercise is what does that.
100%, because also when you have pain, a person's natural instinct is to stop, right? But what happens when we stop exercising or we stop moving? You get muscle wastage, you get joint stiffness. The pain worsens every time you move because your body's just not used to that. And that leads to worsening pain. So you've got the issue of osteoarthritis, but actually the issue of you're not doing enough, which is then going to, as I said, have muscle wasting, further joint stiffness, difficulty with your function and walking. So actually building on those structures that will support your knee, like the muscles, like the joints, like your mobility, will have a significant improvement on how you manage osteoarthritis. And there are so many other things as well that you can do that we know helps it, right? So you've got things like your footwear, if it's lower, if it's your hips, your knee, your ankle, supportive footwear is huge. It's so important to have something with good cushioning at the heel, arch support, a lace. Lace is like my go-to. Like I need all my patients to have a lace, because like that it will provide a much firmer support around the ankle. Pacing is really important. I'm sure you tell that to all your patients, that you don't go from all right, I'm not doing anything to doing a lot, because this is the analogy I use. You want to go like that, but with something like osteoarthritis, that might not be the case, right? But what you don't want to do is when you're having a good day, you shoot up and you do everything. You're like, well, I'm going to walk, I'm going to go to the gym, I'm going to do my exercises, I feel really good. Because what will happen is you dip. So you're constantly up and down. It's about finding that progressive program, right? Pacing yourself with walking. So you do the same amount every day. And then the week later, you only add on by 5 minutes. So that joint isn't becoming overloaded. You wear good footwear, and then you also have your recovery days in between. So I always say with something like osteoarthritis, you just do your weight bearing exercises every other day, because we don't want to overload that joint, because at the beginning it probably won't like it that much.
My take home from that is that I think we tend to think of it as a single joint problem, and you're thinking of it as a whole body problem. Not a whole body problem, but you're thinking of whole body solutions.
Yeah, of course. Because when you're assessing a knee, you always look above and below, right? Because the way that the muscles that are helping protecting the knee isn't just the quads that we all think it is. So much is coming from your glute muscles, your hamstrings, your calf muscles. So you need a really good assessment and a really good program that doesn't just treat the knee, it's treating everything. And then also, yeah, for sure, it's a whole body change. And that's when you see the biggest impact and the biggest effect from making those small changes.
Let's talk about inflammatory arthritis as well, because that's I'm really interested to hear your take on that. So from my perspective as a doctor, inflammatory arthritis can be really challenging, because it can come on really quickly. It can come on in young people, and often the symptoms are like you get a very sudden hot red swollen joint, which is incredibly painful. And I guess my approach has always been, as a doctor, quite medical in that regard, and so referring people. So firstly, again, ensuring appropriate pain relief, usually non-steroidal anti-inflammatory medicines like ibuprofen, but often referring people on. So, for example, for the diagnosis of rheumatoid arthritis, referring people on for specific specialist treatments, like there are medicines called disease-modifying treatments, which are effectively there to suppress the immune system, dampen down the immune response. Sometimes people are put on steroids as well. So I guess my approach to that has always been fairly medical in that regard. And I guess I'm interested in understanding as a physical therapist what the role of physical therapy is for someone with an inflammatory kind of arthritis.
So with inflammatory arthritis, I think our role for that patient is to help manage their symptoms. So they're managing their symptoms through the medication, because ultimately that's what's going to help them. But what's going to happen is, because of the inflammation that they've been having, because of the pain that they've been having, they're going to have a reduction in their muscle strength. They will probably find a reduction in their range of movement. Generally, they feel quite fatigued, quite tired. But what we also know is that actually with inflammatory arthritis, quite often a bit of movement actually helps them just feel that slightly bit better. So for me, with those types of patients, what I really focus on is what can we do really slowly at the start to just make them move a little bit more, and some really gentle like stretching, mobility, and also some really gentle strengthening exercises. And it will always just be that bit slower. See how they respond to it. Do they have the energy for it? Is their pain allowing them to do it? Is their inflammation allowing them to do it? Yes, perfect. We add a tiny bit more. So it's just taking a little bit of a slower approach, I think, for me. And then also, are there any other things that we can do to help them, right? So hydrotherapy is amazing, because when you're in a lot of pain, you have that inflammation. Weight bearing can sometimes be really uncomfortable. We know that with hydrotherapy, it gets rid of 50% of their body weight. So trying to get them access to a pool, or they can go to a pool if they're part of a gym, and providing them with a program that they can do in the pool actually has the world of difference and is much more comfortable, and they're starting to feel more free and more mobile.
What other myths do you hear? Kind of goes, what other kind of mistakes do people make, or misconceptions do people have when they come to see you about arthritis in general, either type?
Running causes osteoarthritis, and I can't believe I've ran all these years, and I can't believe I've got to give up running because it's going to make it worse. I think for me that's number one.
What do you say?
I say it's not true. I say there's so many other predisposing factors that leads to arthritis. Running is not one of them. There's no evidence to show that running will lead to osteoarthritis in your joints. And in fact, we know physical activity is what helps it. So it's one of my favorite things to tell people, nope, that is just not true. And then also that arthritis causes disability. A lot of people will find that, gosh, like, I've got this term, what am I meant to do now? Like, am I going to be disabled the rest of my life? Is it going to give me more disabilities as the further I go on? And I think actually reassuring people that it's something that might never get worse. I think one of my favorite things always to say is that you and I, we can have the same MRI. You could have degenerative changes in your lumbar spine. I will have the same. Why do you have pain and why do I not have pain? We don't know, right? So you can eventually come over that bout, find things that help manage your pain, and you'll be okay.
Yeah.
So I think that's also one of the myths that I really try and help people to not be so fearful of.
People's perception of pain and people's tolerance of pain and just the way people feel pain and tuned to feel pain is so different. And that's not a judgment. There's no judgment behind that at all. It's just the way people are made up and kind of the way their nervous system works means that people perceive things in slightly different ways or different ways. What are your kind of 5 tips for people with joint pain, I guess, or just 3 tips?
3 tips. Pacing. A progressive strengthening program. I always use the word progressive because you want to start slow and slowly increase the load that you're doing. Keeping mobile, keeping active. What would you say yours are?
I think I probably got one, and that is that I mean, and this is from a personal experience, I used to be someone who used to avoid taking pain relief medication if I had a sore joint or even a sore throat. Because I used to be of the mindset of like, only take medicine if it's really necessary. But I'm much more of an advocate now of people taking pain relief because I can see how I think a lot of people have a mentality that like, I need to feel the pain to understand the joint and then so that I don't make it worse. But I think that unfortunately sets up a cycle of repeated pain and anxiety about the pain.
It's true.
And I've been much more of an advocate of someone, if they come in with just someone has lifted something badly at work and they've got a flare of back pain, I will say, absolutely take regular pain relief medication for the next few days. Don't wait for the pain. Get on top of the pain with pain relief medication. Take it regularly. Reduce the pain because actually it will get you back quicker into mobilization, back to rehab. If you need to do physiotherapy, it will get you back to physiotherapy as quickly as possible as well.
Yeah, I think that's a great one.
I think that for me has been my biggest one is actually don't avoid. If you need pain relief and if your doctor suggests you need pain relief, is don't avoid it.
Yeah, 100%. That's a really good one to add because that's what I would always tell a patient, go speak to your GP, go speak to your pharmacist because actually getting on top of your pain will allow you to improve significantly quicker and then you can get back to where you want to be. Yeah.
And if you don't, I think what happens is that it sets up these kind of yellow flag cycles where you then you feel the pain, you become anxious about the pain and actually sometimes just appropriately treating the pain quickly can help you build confidence very quickly, which I think psychologically helps you recover much, much more quickly as well.
100%. Definitely.
Thank you. This has been incredibly insightful. I've learned a lot that I think I can take back to my clinic and my patients, and I hope that all our viewers as well will have gained something. So thank you so much for joining me.
Thank you so much for having me. It's been amazing. Thank you.